Holly Cotton here, and I am so excited about our guest today. So, you guys, I know you forget I'm a nurse because I do all kinds of other things in life, and I have this whole other persona with 82 jobs now. But I wanted to bring it back to a wellness topic today, and I have the person who is going to do that for us. So, I want you guys to welcome Kwame Terra, and he is actually the developer and the founder of an app, and we're all kind of other stuff and whatever. He's going to tell us all his bio information. But I met him at InvestFest, and he was actually talking about his app. So of course, I was ear hustling a little bit whenever he was talking. And when I hear anyone talking about something medical or disparities, like those are always the words that make my antennas pop up. So welcome, Kwame.
Hey Ali, thanks for having me.
Okay, great. So, first of all, before we go into all of the stuff that you're doing, give us your background because I like to kind of preface anytime I have someone talking about something that they are an expert at what they're talking about. Like, we're not just getting someone off of the street that just decided, poof, I'm going to do this. Like, you actually have a background and you are qualified to be talking to us today. So, give us some of your background.
Yeah, so I'll start with my upbringing. I was born here in New Orleans, Louisiana. Grew up in Houston, Texas, and for I came back to New Orleans for undergrad. So I did pre med at Xavier University of Louisiana, where my goal was to become a doctor. My dad told me to go to school, become a doctor, and I thought that sounded like a pretty good idea. Um, Learned a lot, obviously, in college. Got to do some research, specifically in neuroscience and behavioral psychology research. And I started off pre med, but I decided that I was more interested in research and having more scaled impact. If we can find out what like the root causes of problems are and change things on a systemic level, then we could have a lot more scaled impact. Not that being a practitioner or people in the hospital aren't important. Obviously, we need them, right? Acute care is that's key for acute care. But again, the long term sustained improvements that we all are hoping for come with a combination of systemic change as well um, as individual practitioners. So that's kind of how it started. After undergrad, I kind of got on my own personal health journey. Uh, Really, it was just so that I could maximize my own potential as a human being, just trying to become the best version of myself. But it wasn't until 2019, during the COVID-19 pandemic, that I thought it was something that I really should start sharing with people. And I needed a platform and a way to deliver a message that would be received. Uh, I wouldn't say well, because when people do learn their health scores, and I'll get into that in a second, it's not always the most positive experience for them. But during the COVID-19 pandemic, when the virus was preying on the most vulnerable among us, particularly in the Black community, I just wanted to do something so that next pandemic or anything that we face in the Black community, we're in better shape to have a better outcome, right? And so, you know, my first goal was to communicate clearly to the Black community our current health status, and that's what we do through the health score. So when I came up with the idea in 2020, I actually enrolled in a master's of public health with a concentration in health equity. Started the company during graduate school, and essentially have taken everything that I learned, from the environmental to the individual education, and incorporated it into this platform that we built.
So I just also wanted to kind of sidebar on what you said because I know as a health practitioner, I mean, I've been a floor nurse before. I've done what basically every genre of nursing that there is, and I always think it's funny when people know you're obese, you eat terrible, you don't exercise, you don't have any good health habits, and then you tell them that they have high cholesterol or your blood pressure, and they're like in
Mhm.
complete shock. And it's like, you do know you live a terrible lifestyle, like you know that you are sedentary, like you know that you aren't doing stuff. So I think it's funny how you said that people are surprised by their score. So I can't wait to hear some stories about that because it's like, you know, you probably don't have the score
Yeah.
you should have. based off of your lifestyle. So that's
Yeah.
interesting.
Oh,
So
actually, yeah, I wanted to
go
comment
ahead.
on that.
Mhm,
The thing is, we actually don't know, right? Or we don't know exactly
mhm,
how bad we're doing, right? We know that we're supposed to exercise every day. We know that we're supposed to eat a healthy diet, and we know that it's probably not helping us, but we don't know how much it's affecting us, right? We don't know the level of risk
mhm.
that it's creating for ourselves in the short and long term, and that's really where the power of this health score is coming in. People, at any age will see their score, and the day before they might not have been thinking about what their blood pressure was, but the next day they'll come in here checking the blood pressure um, every day to find out exactly what's going on, right? And so that awareness is key, and it's lacking in our community. So
Mm. So, whenever you were talking about like your research and the disparities, give us some insight into that because I know that you were saying that you really wanted to hone in, especially after COVID-19. You really wanted to kind of hone in on that gap because you were seeing everyone was seeing that minorities were having the worst outcomes. Minorities were the ones that had the highest,
mhm.
mortality rate. So give us some insight into how what your demographics are and your research is, and why you were like, I need to really hone in on the minority
Yeah.
community here.
Again, it all comes down to right, the comorbidities, right? Everybody's aware of that at this point. So hypertension,
And let them know
yeah,
what a comorbidity is because not everyone is in
right.
the in
Yeah,
the medical field.
basically any condition that increases the likelihood of you having a severe outcome. For example, if you do get COVID-19, right? So that could be hypertension, that could be obesity, that could be type 2 diabetes, anything that's putting a lot of uh, demand on your system just at baseline. And then when you encounter something like COVID-19, your defenses just aren't as strong to deal with it. Right, your immune system is compromised, as they say, to a degree. And so, yeah, that's essentially a large part of it. Again, we all know that we might be dealing with things, although sometimes we don't, right? I think like one third of people with type 2 diabetes don't even know that they have it. Um, Same thing with pre-diabetes. And yeah, again, it's really about how do we communicate to people that they might not be doing great, and encourage them to go and find out precisely what's going on the inside. Um, the way that I frame the problem is a little different than I think most people think about it. Um, a lot of new developments are coming out related to aging and the rate of aging, right? And what I see is that it's not that people in the black community are suddenly dying earlier from different conditions. We're actually aging faster. And as a consequence of aging faster, we develop these age related diseases earlier in life. And then so it's no wonder that at 54 years old, right, your chronological age of 54, someone might be dying from a stroke, right? What on the inside, their body has actually aged closer to the age of someone that might be 75, right? And the thing about aging is that you can slow it down, you can stop it, and you can even reverse the rate of aging. And that's the real message that I'm trying to give to people. It's like, hey, we're aging faster in the black community as a consequence of everything that we've dealt with here in the United States, right? Right. All of the systemic pressures, cultural pressures, although most of it is just systemic pressures. And this is what we're facing, and then that's why you see disparities in life expectancy as great as 26 years, such as between Lakeview and Treme, two communities here in New Orleans. Um, those communities are less than 3 miles apart, but the life expectancy gap is 26 years. And I think that's the problem that we're trying to solve, right? How do we structure environments, and how do we educate people such that we can slow, stop, and reverse the rate of aging that exists, and start to prevent and reverse some of these chronic diseases that plague our community. So that's kind of the basis of our focus on the Black community.
So I wanted to say that anyone that follows me, they know my story. I'm a huge advocate for breast cancer because that's kind of like my story. Like I got diagnosed with breast cancer and I had no family history of it. I was 130 pounds. I was like the insanity queen. I was working out every day. I was super lean. I never smoked. I never did any, like, so my diet was great. I had all of these things. So I thought I was eliminating all of these risk factors. And then of all my friends and family, I'm the one that got diagnosed with breast cancer. And I was like, now, you know what? But anyway, we're gonna talk about that next month in breast cancer awareness. But I just wanted to just say that too, that I do think that there is a huge niche for this because, like you said, people may be going along, of course, not just the ones that earlier that I was saying, like, if you live an unhealthy lifestyle, you got to know that there's some consequences coming. But for us that are in these healthy, or we think they're healthy lifestyles, they may not even think about, like you said, the aging, the premature aging. So I love that you are educating on us on that. And now, whenever you're talking about public health, because I always meet people, and there's all of these different genres of like medicine. There's the ones that take care of people. There's the researchers. There's the people that are in the labs creating, working on treatments and medications and stuff like that. So whenever we're talking about public health, just for anyone that doesn't know, can you just tell us what like your education is in public health and what that
Yeah.
means?
Yeah, that's a great question. And before I answer, I do want to comment on your experience when it comes to uh, disease and development of diseases, right? There are different factors, right? There's your environment, there's your lifestyle, there's genetics. Um, some of it's out of our control, right? All that we can do is give ourselves the best chance to either prevent, right, and not develop a condition, or if we do, give ourselves the best fighting chance to deal with it or treat it, right, whatever it is, however it is that we're working to eliminate it, right? You likely had a better outcome as a consequence of the kind of shape that you were in, the diet that you were.
Yeah, that's what they keep
Right, and
telling
that's
me.
real. That's real, right? And so, you know, unfortunately, right, we live in a reality that uh, our food is adulterated. Um, the environment, I mean, the air is problematic, um, and so we're exposed to so many toxins on a daily basis that no matter how hard we're working out, how good we're eating, we're still exposed, and so there's still a risk, right? And I'll get into fasting and its power to help mitigate some of that in a bit, but um, the definition of public health is the art and science of prolonging human life. That's the definition, right? There are a lot of ways that we can work to prolong human life, right? We can educate people on how to live a healthy life. We can structure environments such that they're health promoting, right? Can we set up in communities or neighborhoods to where people can walk to everything that they need, whether that's work, the grocery store, the park, whatever it is, right? And there are plenty of examples of how to create these health promoting environments, but that is essentially what public health is, right? Art and science of prolonging human life. And health equity, which is what I focused on and what I studied in graduate school, is really just ensuring that each individual has the best chance to live as long as they possibly can, right? Based on their unique needs, preferences, perspectives, so on and so forth. Um, yeah, health equity is focused primarily on the environmental factors, I would say, because environmental factors drive 60% of health outcomes, upwards of 60% of health outcomes, and that's nationwide, worldwide. If that's all we did was make health promoting environments, a lot of it would just kind of follow, right? People's lifestyles would improve just by default. Um, I do like to offer though an extended definition of public health. I think it's incomplete. The art and science of prolonging life, because we can prolong life, but if people aren't enjoying life while it's prolonged, we
Mm.
can keep people alive for so long. Um, and so there are two components that I think are missing from that definition, although I'm sure they're going to be updating it. It's it's a prolonged health span, right? Not just prolonged lifespan. So health span is the amount of time that you're able to live kind of functionally on your own, healthy and happy life, right? So that's one piece. The second piece is to prolong the desire to live, right? How do we set up the environment? How do we set up society such that people want to be here as long as they possibly can, not to miss out on this experience, right? That's when we'll know we've got it right, and not just in health, right? Just in society, when everybody wants to be here for as long as they possibly can. And I know that's something that we can do, um, assuming that we all commit to it. But that's really what public health is about. And again, health equity is just ensuring that everybody has that based on their needs. Yeah.
Okay, thank you for explaining that because, some people, again, this might be the first time they ever hear about
Hmm.
any of these topics
Yeah.
or whatever. That's the whole purpose of my show, to kind of just take this opportunity to find people that are doing things that are trying to be the change, and then also defining what the change is. Like, why do you need the change? Why is this applicable to you? So
Of
thank you
course.
so much. Now, okay, so now let's get into the whole thing that caught my
Yeah.
ear about the app. So you're sitting around doing your research, going through school, you're learning about all these disparities that are in the Black community, and you're like, you know what? I need to do something about this. So, how does that equate to? I'm going to come up with an app with some indicators and some check ins and some monitoring. So, we want to know
Right.
the story of the development
Yeah.
of the app.
Yeah. So again, I came up with the idea before I started graduate school. So I came up with the idea in summer 2020. I started graduate school in fall of 2020 because I really wanted to understand the Black health problem. Right. It can't just be that we don't know or don't care about our health. Right. It's got to be a lot more than that. Um, I actually came up with the idea of the health score before I even started my graduate program. What the way we came up with it, I actually couldn't tell you because I don't remember. But I just remember that I wanted to communicate clearly to the Black community our current health status. Honestly, I think I found the idea on Google, or Google the idea of a health score, and found some development partners that are working on something similar, and reached out to them and started a relationship, and it's been going on for now for 3 years. And so that's kind of how that process started. But the majority of that I've been in school, right? So I just graduated. I've been out for a year now, and honestly, halfway through my graduate program, you know, I wasn't even sure if this was going to be the solution, right, or even a part of the solution, because what you learn specifically in this health equity uh, public health program here at Xavier is about how the environment is really what's driving everything, right? We call them social determinants of health, right? Education, access to health care, access to healthy food, all of these factors that are really shaping people's behaviors and shaping people's um, epigenetics. And I'm not by no means an expert on that, and so I won't speak on it. But essentially, oftentimes people talk about how we're predisposed, right? Because it runs in my family, so on and so forth. But the predispositions are only activated if the environment calls them out, essentially, right? If you might be predisposed to type 2 diabetes, yeah, it might be easier for you to get type 2 diabetes, at baseline. And if you are eating a poor diet, then yeah, you're definitely more likely. But that's not exactly why, right? If you live in a healthy environment, if you live a healthy lifestyle, that stuff can be kept at bay on the whole, right? And so that's that's a lot of what I was learning about in that program, and it wasn't until about halfway through when I realized what I could really do with our user data to inform and drive social solutions, right? So what we're going to be able to do with the platform is help people or help institutions, all health stakeholders that we assume have a vested interest in improving the health of our communities, although we're not going to bank on that per se. Is we're going to be able to use our data to inform and drive these solutions. We can compare and contrast on a community level different health scores, different lifestyle factors, and be able to say, okay, look, this community has the same lifestyle as this community over here, right? But they're still experiencing certain amounts of disparities, right? They're the answer may lie within the environment, right? And so we can essentially eliminate lifestyle as the factor, which is what they like to do often is put it on the individual. Right? It's this person's fault. They're lazy. They don't want to, you know, they don't want to exercise or whatever it may be. And so we spend uh, money on health promotion campaigns, right? Instead of just structuring the environment such that it kind of forces the healthy choice, right? Makes it the easy choice. And so that's really what I determined to be the ultimate value proposition of the platform. So what I like to say is that we provide real-time health education to individuals through a health app that's kind of like Credit Karma, but for your health. And then on the other side, we provide real-time health data and insights, or we use real-time health data and insights to inform and drive social solutions in our communities. So that's kind of like the complete picture of the platform and how we kind of got started.
So, whenever you're talking about the health score, what are the actual things that you are measuring for a
Mm-hmm.
health score? I need to go on, you guys, make sure you click on Kwame's page or the business page because they actually have like the link in there and it tells you to go do
Yep.
the test or it's like an initial
Mm-hmm.
assessment or something. So make sure you do it. I'm gonna go do mine. I promise you, I'm gonna share it before I post clips about the episode. I'm gonna
Yeah.
go do mine. So, what exactly are the indicators that you guys are measuring, or like what equates
Yeah.
into the health
Yeah, it's a good
score?
question. And right now, the health score is only based on individual information, right? So it's not aren't any environmental factors that go into play currently. But we track over 100 different health metrics, right? So that's anything from your lifestyle, right? So how active are you? How many steps are you taking per day? How many workouts are you doing per day? How many calories are you burning? We also track sleep. We track mental health, right? So we track that through psychometric questionnaires, right? Just kind of evaluate mental well being. We track nutrition, right? Similarly through questionnaires. We also track mindfulness, right? So if you do a meditation, if you use a meditation app and you track that, it automatically be linked to there. And then as well as, and most importantly, I would say, is your medical health information, right? And that includes your family medical history, um, as well as your blood pressure, your glucose, um, cholesterol, triglycerides, and many different biometric or biomarkers that are important for indicating what kind of disease risk somebody might have. And so all of that comes together into a comprehensive score between 0 and 1,000 that represents your overall health.
So let me ask you this because I try to make questions or little things I
Mm-hmm.
want to sidebar on, but you know
Mm-hmm.
people. And you know when people feel like they're not doing right, or maybe something they're doing could be questionable, or is that going to make my score bad if I tell the truth about that? So, how do you guys have a plan of action, I guess, or whatever, call to
Yeah.
action? I don't know, whatever, I don't know what it's called, but how do you guys foresee sort of troubleshooting that to where you're pushing people to say, hey, it's important for you to be honest. This is not a judgment zone. Like, how are you guys kind of navigating that? Because the first thing is, whenever people, I could tell you as a nurse, because I worked in gynecology for a while, and the doctor would always be like, so are you sexually active? No, or how many partners have you had in the last year? Oh, one, and it's just like, but the reason why they're asking is so that we can help you. It's not a judgment zone at all. So how are you guys figuring out, how you're going to navigate that to make people know the importance of
Mm-hmm.
telling the truth?
That's a really good question, and our answer to that, my response to it, is based on our approach to the design of the platform, right? So we have our core development, but essentially all of the AI coaching and the layout of the platform is going to be informed by the community, right? So there's this approach to research and development in public health or in health equity in particular called community based participatory research. And it's an approach to the development of solutions where the researchers or entrepreneurs or whoever it is works hand in hand with the community in the development and design process. Right. So we host what we call community design sessions where we introduce people to the concept of the health score. We ask them about their current health challenges and struggles, and then also identify potential opportunities or ways that we can offer our solution to help improve their lives, right? So it's not something that I'm doing alone, right? It's something that we're working together with the Black community to build. So it's our thing, right? Our vision is to make health part of Black culture, and if we want to make something a part of a culture, the culture has to be a part of making the thing. And so that's one thing, right? So literally in these community design sessions, whether people are there like dragging their friends over because they just got their score and they're like, hey, come see what your score is, right? So they can laugh at each other or whatever. Um, or some people have straight up told me like, hey, look, I don't share my health information generally, but you're Black and I trust that you have good intentions with my health data, and so I'm gonna share it, right? So like that's a key part of it, right? That trust, and that speaks to the importance of having representation just in healthcare in general, right? Because we have every reason not to not to want to share our health information with people, but it's important that we understand our current health risk, and we're going to have to share health data to do that. But if we're sharing it with each other, right, through a platform that we all are part of building, that we all, and we'll get into it later, that we all own, then that's our best bet, and it's so far people have been willing to. Now the one thing that we see people are hesitant about sometimes is on the smoking question, right? Most people don't smoke cigarettes, right? But they'll ask, and sometimes we're on college campuses, they're like, what you mean by smoking? And they'll ask,
Right. How much smoking we talking
right,
about
and they're like,
here?
oh, y'all federal, bro, like why y'all asking us this? And so, oh no, we're talking about tobacco, and they're like, oh, okay, I don't smoke tobacco. I was like, oh well, what do you wrap your weed in? And it's like, oh, mm. Right. So you smoking tobacco to an extent if you're wrapping in like a Rillo, backwood, anything like that. Um, so yeah, we navigate it again by just we're part of the community. At our community design sessions, we generally have college students who are running them, so people are just a little more open and willing to share generally with their peers or with younger people because they want to support. So different ways that we tackle that problem, but at the end of the day, it's the sentiment that it's something that we're all building together. Yeah.
Okay, got it. So just tell the truth, y'all.
Yeah,
Just
and,
tell
and
the
look,
truth.
we
It
don't
just
see the static health score assessment, kind of like the snapshot that's on our website that you're going to be sharing with people. That's no nobody's looking at that to determine who they should talk to or whatever. Like nobody's looking at that. It's all to inform the design of the platform, and then on the app, the only person that can see your data is you, right? We can't. It's all anonymized. Nobody knows what your health. I mean, you can make your health score public if you want, but that's it, right? You can't share all your other data. Your biometric data or your sleep data, any of that. That's all private to you, unless you decide that you want to share it for some reason. Let's say you don't want to pay for your subscription to the app and you want your insurance company to pay for it. Well, they're probably going to want something in exchange for that. That's not our business model. Part of why our business model is direct to consumer is because we don't want those risks essentially, right? Because it's not obvious always that they have the same intentions and that we're always aligned. So if you don't want to share your data, pay for the platform with us. So
right, right. Because a lot of people are scared that the insurance is going to identify those as pre-existing
absolutely.
conditions or. So totally get that.
So
Okay,
yeah,
so I
you
love
would only
that. So
be
you
lying.
don't
You'd only
have
be
to
lying
have.
to yourself. If you,
There you go. That part. That part. I just want to
Mhm.
let people know. I just want to throw it out there. Okay. So I go on, I take my assessment, I find out that my score is 2. I'm real bad. I have the
A
worst
two.
score.
Okay.
Because the lower your score, the worse off you are. You guys, 0 to a
Mhm.
thousand, and so now I have a score, and I see what's going on. So then, how are you guys using that score to help me be a better person? And what are some of the most common, I guess, things that you guys are seeing, like red flags? Like, what are the most common things that you're saying, like, dang, this is kind of like a trend here where most people are saying, most people are showing that this is something they're at risk for.
Yeah, that's a good question. So when you first download the app again, you complete your initial health score assessment, and that is really just a snapshot, right? And we ask you like 12 questions, and it maybe one or two questions from each category: mental health, physical activity, so on and so forth, and you get your assessment. But over the next several days, several weeks, the app's going to get to know you a little more, right? It's going to identify how much you actually exercise. You might have said 6 hours in the initial assessment, but that's not consistent with the reality of
You are not the father, you know.
right, because
Like that.
so that's why I just let people get through the first assessment, but in reality we'll see what their life is really like after that. Same thing with sleep. um, and the AI coach that comes in next is really the I wouldn't say it's the core part of the solution. The core part of the solution is the health score, right? That has seemingly been enough to get people's attention and get them to start taking action, right? um, but the AI coach, we set rules to determine what kind of messages and when to send certain messages to people, right? For example, if somebody has a score below 549, then they might be at increased risk for developing certain health conditions early in life. And so our goal is to get them to the doctor, right? To identify, to see, look under the skin and see if there might be something going on that they might need to evaluate sooner than later, right? So you may receive a message like that, um, so on and so forth, right? And as the platform collects more data, as we learn more about the relationship between the health score and certain disease outcomes, we'll be able to even tell people things like, hey, based on your health score and based on your lifestyle, based on these other factors, you're on track. You might be on track to develop this condition by this age. Here's what you can do to prevent that, right? Because the fear and the problem that's really occurring is that these conditions are developing earlier and earlier and earlier in life, right? It's getting worse with each successive generation. And my greatest fear really is people lose, there's children, black children in particular, losing parents early in life to preventable diseases. One story I always tell is about my mom's friend who lost her husband to a stroke at 46, had a 13-year-old son. It's, we can't we can't afford to do that, right? Not for something that we can prevent. And so that's really what the message is about, and what the platform is about, and why it's real. Because when people do see their health score and they see how it compares to others, they just like, damn, I gotta do something, and they can do it in the privacy of their own platform, right? It's not like you go to the doctor one time and you might fear that they're judging you, or I guess it's you in the platform. You got your score. You know how you're doing. We want you to go to the doctor so you can get those data points and put them in the app so you can know what your true health risks are. But it's you and your journey, and you can add friends on the platform so you guys can kind of work on your health scores together. You can create challenges between your friends, so on and so forth. you know all of the uses of the platform are still to be determined, because we're still early in the user base, in our user base. I mean, I see people do things that I don't even use the app for currently. But yeah, it's just we're still in that growth and learning stage. So yeah.
Well, one of the things I think a lot of people struggle with, and this is no matter what it is that the topic is, whether it be mental health, whether it be physical health, whether it be financial health, whatever it is, the biggest thing that people struggle with is
Mhm.
accountability. And I think that you basically have like honed in on that a few times. Like, okay, so one, you got to be honest. You got to own your lifestyle. You have to tell the truth. What are you doing? What are you not doing? And now this is it. Like now this is your accountability. Now you're being exposed. Now you're whatever, like you said, it could be some risk factors that they didn't know about, or whatever it is that's going on. Now we're giving you this information. So what are you going to do with that information? Are you just going to throw it in the app and be like, "Ooh, I'm at a risk for diabetes. Okay, let me
Right.
go." Let me go get some cheesecake. Like, now you have to be accountable for yourself. So I'm glad that you guys are giving people the power. You're empowering the people, but with the empowerment also comes with some
Yeah.
self accountability as well. So I love that. Now, I know that you have something that's called the Health Blueprint. how to be healthy. So what is that
Yeah, so
about?
I won't get into all of it. It's kind of like our 10 step
Oh,
blueprint.
okay. Yeah. You got to get the app. You got to
Yeah,
pay for
no,
it.
no,
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 I'm
that's
kidding.
not it. I just
You
I don't think we had that
you
much
got to do
time.
the assessment. You got to do the assessment.
Yeah,
We're going to make them have to go
no,
do
that's
the
fine.
assessment.
I would have no problem running through the whole blueprint. I just didn't think we would have enough time. But
Hmm.
when people ask me what the most important thing to do to be healthy, they're they're sometimes surprised because it's not a factor that they generally relate to health, right? And that's purpose, right? You have to, on some level, believe sincerely, or as sincerely as possible, that your life matters. What you do every day affects you, your family, community, so on and so forth, and that each of us is responsible for the trajectory the trajectory of our society, and I mean that like seriously. And whether you think it's real or not, it's still true. Um, what you do affects the rest of us, and I think that taking responsibility for that and sincerely taking ownership of that kind of imbues you with a sense of meaning, such that you can bear this everything that we have to deal with in life. Right? This stuff is tough. Right? A lot of it's unfair, but we have to bear that almost as if we chose it, um, that voluntarily, and that's the key part, right? Some people bear it, but like involuntarily, and then it develops, a lot of they develop a lot of resentment toward the life of other people, so on and so forth. Voluntarily accept the life that you have, and commit to the highest ideal that you can imagine for your life and for society, and as a consequence, everything that you do will be imbued with meaning. That's the most important thing, because with that or without it, you're not really going to care about you know eating right, exercising. You're not going to want to do things that are inconvenient, right? That require any resistance psychologically, right? Because all you're really going to be doing is just looking for the next, short term pleasure that you can get to deal and tolerate the tragedy and suffering that you might be dealing with in life. And again, when I tell people that, they're like, "Wait, that has nothing to do with health," but it has everything to do with health, right? In fact,
Everything.
meaning and community together can add up to 14 years to your life expectancy. It's the most more so than diet, anything else. So it's the most important part is purpose. Um, Next is to know your numbers, right? You can't improve something if you're not measuring it, right? So the first step, the first thing that we recommend to everybody is to either go to the doctor, go to an event where they're doing health screenings, and find out just exactly how what your current health status is, right? So blood pressure, glucose, cholesterol levels, you know, you can get all of these things at an annual checkup. Again, and they offer a lot of these things at kind of free health screening events that happen throughout the community. Once you know your numbers, then you use that information to inform your diet, right? So let's say you have high blood sugar. Well, okay, obviously you want to reduce your sugar intake, right? Or if you have high cholesterol, reduce your saturated fat intake. That one in particular is really important because heart disease is the number one killer, right? And the number one driver of heart disease is cholesterol level. There are, and it's a little more precise than that, but I'm not going to get into it. Um, there are animals, right, that don't have LDL cholesterol, right? It's just not a part of their composition, and there are no incidents of heart disease in these species. There are humans with genetic mutations to where they don't have LDL cholesterol, and the incidence of heart disease in those people is minimal compared to the rest of the population. Um, the number one driver of LDL cholesterol, increased rates or increased levels of LDL cholesterol, is dietary saturated fat. Period. Um,
That means that y'all on Tuesdays in that line at Popeye's Chicken.
Yeah,
There you
you
go.
know, and it's really in America anyway. It's a combination of the fat and the
Mm,
sugar, right? People think it's just the sugar driving diabetes. It's really a combination of, like a muffin, for example. It's just like perfect
mm.
combination of butter and sugar. That's just anyway. Won't get into it. Know your numbers. Know your numbers. Go
Yeah.
find out what they are.
Have a whole show. Look, we're gonna have Kwame back, and he's gonna tell me after I have my stuff, he's gonna give me all
Hmm.
his insight on
Yep.
what I need to do. So,
Yeah. So that's step two. Know your numbers. Step three, create your diet, right? And it should be based on, again, those numbers. Step four is related to step three is your eating schedule. Now, this is probably the most important kind of behavioral change that people can make to improve their health. And it has to do with fasting or intermittent fasting, whatever you want to call it. Um, our bodies need a break from digestion. You can't be in what we call the fed state all the time and expect to be healthy long term. Period. Now, I know here in America we're told that we need not to go hungry really at all, right? We need to eat breakfast first thing in the morning. It's the most important meal of the day. Snack in between breakfast and lunch. Have a nice lunch. Snack in between dinner and lunch. I mean, yeah, dinner and lunch, and then have a nice dinner. Most of us, are eating from within 30 minutes of when we wake up to the wee hours as we're falling asleep. And the thing about when we're eating and when we're processing food is that it's expending a lot of energy, right? In the fed state, which we're going to have to eat food, right? We can't go without it. But when you're in the fed state, it actually accelerates aging, right? So it's a part of aging where, like, we can't really get away from, right? Unless you're one of those people who apparently can live off of with no food. I don't know if you ever heard of a breatharian. I don't know how much truth there is to any of that, but yeah. So
mhm,
anyway, uh, you have to eat, but the most powerful thing that you can do to extend your lifespan is to eat less frequently. That doesn't mean necessarily eat less, right? Although most of us do need to eat less, right? Most of us are obese or overweight, and so most of us do need to eat less. But more importantly, we need to eat less often, because we need to give our bodies a break from the digestion process. And so, what might that look like? Um, 12 hours of eating, 12 hours of fasting a day is a good place for people to start. That could be a good eating window for you to set up. Some people go on to 8-hour eating windows where they're fasting for 16 hours a day, eating for 8 hours a day. Whatever kind of works for you, and make sure that it's something that can work with your just general life schedule, right? You don't want to be that person that's like at lunch with the family or something like that, and you're just like, oh no, I'm not eating right now. You don't want it to affect your social life, right? Because then that's another factor that's going to affect your health.
right, and then you're not gonna stick
Exactly,
with
and that's a huge component of like
it.
behavioral changes, right? It's not just like what's effective, but it's just like what's also likely to be adopted by individuals. Um, but the main thing that happens during a fasted state is something called autophagy or autophagy. And again, not to get too technical, but this is the process by which your body breaks down old and damaged tissues, and it literally make uses those proteins and tissues to make new ones, right? Younger proteins and cells. And again, it's the most powerful practice for extending lifespan, and the easiest way to get into that autophagy state is through fasting. So anyway, those are the first three. Everything else is kind of general. Maintain a healthy weight, sleep 8 hours a day if possible. Sleep is the foundation of mental health, physical health, and performance. I schedule my sleep before I schedule anything else. 8 hours a day, period.
Mm.
Yeah,
I'm serious about my sleep too, Kwame.
yeah. No,
Don't
it's
play.
it's
I got to get my
absolutely
sleep
it's
in.
it's the most important thing, right? I don't know how people function without at least 7 hours of sleep, but some people are a little different. But brush your teeth every day
Mhm.
is very important. Um, some just simple stuff. And the mental well being.
Right.
I think a lot of the mental health issues that we're dealing with right now are related to the first thing I said about meaning,
Mhm.
right? Again, life is too hard not to have something that is meaningful in your life, and uh, the easiest way to find it, and though again it may be surprising, is in responsibility to yourself, to your family, to the community. Find something to take responsibility for, and as a consequence, you tend to find meaning in that. And that's just how we're wired, and it's something. It's a message that's missing from society, if you ask me. Um, and it's a core part of why people are so quick to look for joy and pleasure in external things that are generally short lived, and don't lead to any long term sustained. Um,
I always say that, like, whenever I talk to people, that's why I love having people that are doing things on my show. I'm like, oh, so tell us how you found this, how this became your passion, or tell us how this became your purpose. Because so often I meet people and I'm like, hey, so what's your purpose in life? And I can tell you my friends, or some of them as well. And I'm like, I'll talk to people that I know, that are close to me. And I'm like, well, what's your purpose? Well, I don't know. Like, you just going through life with
too
no
hard.
purpose. You just going work for the man. Yeah, I'm like, y'all better get a life. Y'all better figure it out.
No, really.
So, but I know. I'm like, shoot, I got 38 purposes. Make the world greater.
Yeah.
Sprinkle some glitter. Like, motivate people. Anyway, but okay, so I know that we covered a lot of information, all of that stuff, but I definitely want, because obviously people are intrigued, people want to know about you, about the app. So give us how they can support you first of all, because I know you guys are let's support the brand first of all, and then how they can get access to the app, the next steps, all of that great stuff, and also drop your social media handles and
Yeah.
anything that you have coming
Yeah.
up.
So you can find us anywhere online at Bear Health. So at BEHR Health. Um, Primarily posting on Instagram. Do a little bit on Facebook too. So that's one way that you can support. Just follow our journey. I like to think that our content is entertaining. One thing I didn't mention is that we work with about 50 students here on campus at Xavier University of Louisiana, and as much as we work hard, we also have a good time. I'm generally the butt of every joke in the office, and that people find that pretty entertaining. So if nothing else, come and enjoy our content. Um, One thing I mentioned earlier is that instead of going to traditional funders, traditional investors, for example, to launch the platform, uh, we want the community to own the platform. So right now we have what's called an equity crowdfunding campaign, where anybody for as little as $100 can own future shares in Bear Health. Right. So if you believe in what we're doing, you think this is a good idea, you can become a part owner of our company, and so we invite people to do that. Um, that campaign is currently running. We're about halfway done with it, and so you know, make a reservation. As soon as you see the value in it, and then me personally, everything is at Kwame Terra, Twitter, um, Instagram. So
And that is
that's right.
KWAMETERRA. Okay, I love that. I love that. So, yeah, believe in the cause, support the cause, support him, follow him. Lots of good information. I'm telling you, they have a lot of educational videos as well, on his page, on the Bear page. Is it Bear app, or is it platform? What do you
The
call it?
Bear Health app. We haven't decided on the official
Okay.
name yet, but
Okay. Because I don't want to
yeah.
limit it to just the
Right.
word
Yeah,
app,
yeah. That's
because
a good
you're like
point. We're
a
starting off with the app, right? App is a good way to reach a lot of people quickly, but we want to become the primary healthcare resource for the Black community. So eventually, we'll have clinic systems later on top of the platform, built around this kind of what's called the
movement.
functional medicine kind of whole health approach to health. But yeah, and also the most important thing that people can do is go and get their health score at bearhealth.com. Yeah.
Okay, that's great. And like I said, whenever I post all of our promo stuff, I will have my score at the very bottom of the
Okay,
note. So mind y'all business.
that's cool.
So thank you so much, Kwame, for telling us your story, motivating us, and hopefully, you guys, even if you don't go on and support him and you don't go do the app, you don't do stuff, like he said, know your numbers. Use this as a informative show of where you see the disparities. We've talked about risk factors. You maybe need to now say, oh, you know what? I'm
Yeah,
going to take some accountability. Maybe this show is for me. So maybe we reach someone even if they don't
yeah,
use the app to go and get tested and all of
awesome.
that.
Yeah,
So
no,
thank
thanks for having me. I
you.
had a great time.